All right, so we're gonna attack some Immuno Pharm right now. Let's check out some of these questions, see what we got today. All right, so what do we have? We have treatment of which of the following agents would benefit this patient. Immunotherapeutic agent would benefit this patient. Interesting. Well, what's going on with this patient? Well, we have 45, African American man, comes in, left side of flank pain of 3 weeks. All right, something's going on with possibly his kidney because they said flank pain. Exam demonstrates a palpable mass in the left area. Again, making me think kidney. We order a urinalysis. Now, for the most part, guys, I like to leave the labs for last. I'll look at them after I have a general idea as to what's going on. We jump down. CT shows multiple foci in the lungs, as shown below. We remove the flank mass, and we see shrinking of the lung foci, meaning this issue originated from the kidney. So this patient has a kidney issue. Color of the urine is pink, no bueno. pH is acidic, specific gravity, protein, da 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 da. There is blood in the urine, hematuria, sounds good. So I'm thinking this guy possibly has kidney cancer, maybe some renal cell carcinoma, something like that. All right, so therefore, which of the following immunotherapeutic agents would benefit him? Well, if I give him recombinant IL-2, that would help increase T cells and natural killer cells, so possibly. Monoclonal antibodies against CD20, I don't see how B cells are associated with this. Interferon gamma stimulates macrophages. Not really see how that plays a role with this one. Interferon alpha antagonist, well, I wouldn't want to go against interferon because this is inflammatory in nature, so I wouldn't want to do that. And now I'm down to anti-CTLA4 antibodies and recombinant IL-2. So now what do we do when we're down to two answer choices, right? Well, I go with my gut feeling. Now, I'm not a big fan, or not necessarily, but I'm not really sure what they're saying, what they mean with anti-CTLA4 antibodies, but my gut says it's possibly E, and I am down to two. So what I'm going to do is I'm going to go for the bottom answer, and let's see what happens. Excellent job. So recombinant IL-2. The name of this drug is known as aldesleukin. Aldesleukin. Okay, so what does aldesleukin do? It's literally just that. It'll stimulate IL-2. And what does IL-2 do? It leads to the increase of what was it? I said T cells and natural killer cells. Interesting. And then these natural killer cells, I'm sure you remember, are known for attacking tumors, malignant tumors, such as maybe renal cell carcinoma, amongst other things. Okay, maybe breast cancers, liver disease, etc. All right, great. So recombinant IL-2. So if I just take a look over here and I put aldesleukin, I will see here in my LopsNotes that it's actually jotted down here. So had you had these LopsNotes, you probably also would have been able to remember that aldesleukin, IL-2 is a recombinant IL-2. What does it do? Normally, IL-2 will stimulate T cells and natural killer cell production. Aldesleukin, what does it do? Stimulates IL-2 production, therefore great for renal cell carcinoma, amongst other things, and metastatic melanoma. This patient just so happened to have had renal cell carcinoma. All right, very good. Let's try another one. Describes infliximab's mechanism of action. All right, y'all. So then this is a very straightforward question. There's no need to really have to read the entire vignette because it's very straightforward. They're asking us, how does infliximab work? So the first thing that should come to everybody's mind when you think of infliximab is always tumor necrosis factor alpha, something with tumor necrosis factor alpha, whether it's a decoy or it stimulates it or inhibits it, something with TNF alpha. That being said, tyrosine kinase does not say TNF alpha. D says TNF alpha, yes. C says TNF alpha. B does not say that, and A says it. All right, great. So now I'm down to three possible answer choices. Of the three, I'm going to eliminate one of them that just doesn't really sit well. Infliximab is not a decoy. That's more etanercept. Therefore, I'm down to C and D. So does infliximab bind to and neutralize TNF, or does it bind to and neutralize TNF on T cells? Aha. So the real question is, who's going to release TNF alpha? Well, you got to know that it's not the T cells that release TNF alpha. As a matter of fact, it's the macrophages. So I want you to remember that. The macrophages will release TNF alpha, and then that will lead to more anti-inflammatory effects. So if I take a look over here, and where is it? We said infliximab, right? So I'm going to look at infliximab. Inflix for inflammation. You see that? You see that? And what do I see? I see that normally this little guy looks like Pac-Man. That's a macrophage. And macrophage leads to the stimulation of TNF alpha, which leads to inflammation. Well, what's the mechanism of action of infliximab? It inhibits TNF alpha, and TNF alpha inhibitors like infliximab are good for treating a whole bunch of crap: Crohn's, rheumatoid arthritis, ankylosing spondylitis, and psoriasis. And know that the side effects could be infection, it'll reactivate TB, as well as drug-induced lupus. Also know we have a couple of other mAbs that look and sound the same: adalimumab, sertulimab, and golimumab. All right, that is infliximab. Notice how I have much of the information already jotted down in the LopsNotes. So I would highly recommend that you all get yourself a copy of this as of yesterday. All right, what do we have here? Mechanism of the drug given to the patient that is similar to that of the drug approved to treat which type of cancer? Got it. So what is the mechanism of the drug given to this patient to that of the drug approved to treat which type of cancer? Got it. So we have 70, retired biochem. He has age-related macular degeneration. The common finding in older people. Receives injections in the eye. He poses a question to the physician. The physician explains that this new drug will help prevent the creation of new blood vessels in the eye. So what drug or what substance allows the creation of new blood vessels in general, regardless of whether it's in the eye or not? Remember, it's VEGF. VEGF. Okay, that'll increase my blood vessels, increase the amount of blood vessels I have. That being said, what we're trying to do, because this guy has age-related macular degeneration, what we're trying to do is prevent the creation of this. Okay, why? Because it'll lead to wet macular degeneration. Not good. So then what drug can I give to inhibit VEGF? Anyone? That's right. Bevacizumab, I believe is what it's known as. Bevacizumab. The V in bevacizumab, I want you to remember V for VEGF, bevacizumab. Okay, great. I have the drug of choice. That doesn't really help much though, because now I need to know what else, right? What else do I give bevacizumab for? Well, I know it's not for multiple myeloma. I don't believe it's for prostate cancer, especially if it's hormone sensitive, because it has nothing to do with VEGF. And then I'm down to 2, colon cancer and Hodgkin's lymphoma. Now, Hodgkin's lymphoma, I'm not thinking of immunosuppressants. More often, I'm thinking of some sort of anti-cancer drug, maybe an alkylating agent, things of that nature. That being said, I'm left with colon cancer. Very nice. So here it's called ranibizumab, but what I want you to know is that ranibizumab happens to be bevacizumab's brother. So they just happen to be related to one another. Check this out. Oh, it says it right there. Like ranibizumab, bevacizumab does the exact same thing. Great for colon breast cancer. So I come over here, take a gander at bevacizumab, and I can see that it's jotted down right here. And what do we have? We have VEGF normally will stimulate new blood vessels in inflamed or neoplastic tissue. So mechanism of action is it inhibits VEGF. And check it out: colon cancer, renal cell cancer, non-small cell, as well as eye issues like the macular degeneration that we were just discussing right now. All right. So this is a sample of the LopsNotes. What I wanted you to notice is that the majority of the information that they will ask about in regards to regarding the questions will be found in the LopsNotes, and I have all of the drugs jotted down here. So I would highly recommend you get yourself a copy as of today. It is very straightforward, very simple. A lot of the students have been very pleased with the results. So this is definitely something I recommend you get into. Get yourself a copy today. Thank me later once you get your pass. And yeah, have a great rest of the day, everyone.